everyone, welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today we are going to talk about a very important book that has been released by Thomas Reuters on health, law and ethics critical reflections. In recent times, we have seen a very sharp rise in the growth of consumerism in the healthcare world, where the services that are provided by a doctor who were earlier considered equal to God, but these services are now being compared to commodities. There has been a 400% rise in medical negligence cases before the courts, and in such scenarios, many doctors who are unaware of the position of law on various aspects find themselves at loss. At the same time, there is an increased, rather a growing need for practitioners to be aware about the ethical clinical practices, which may not be a legal requirement but is absolutely necessary for upholding the sanctity of the medical profession. So let's talk a little bit more about this book. As I previously mentioned, it talks about the health, law and ethics. It has a foreword which is written by Dr. Devi Prasad Shetty, who is the Chairman of Narayana Health. In the foreword, he talks about the slow shift in the status of the healthcare professionals who were once healers of a noble profession to today's different scenario where they are even being assaulted. Now, the main reason he explains is because of the lack of awareness and the understanding of the healthcare workers' rights in the eyes of the law. Now, if I talk a little bit more in detail about the book has close to 20 chapters written by expert lawyers and doctors on various aspects of medical law and ethics. Some of these chapters, they even include law of medical negligence, medical profession and its regulation, law of consent, and even the medical treatment, end of life care, the legal framework, the law of organ transplantation, and many more such topics. Now today we have with us Dr. Alexander Thomas, who is the President of the Association of Healthcare Providers in India, founder and patron of the Association of the National Board of Accredited Institutions and the Consortium of Accredited Healthcare Organizations. Dr. Thomas has effected far-reaching policy changes within the healthcare landscape, both at the national as well as the state level. He has played a crucial role in the Insurance Regulatory and Development Authority of India, making NABH entry-level accreditation mandatory for the empanelment of hospitals, impacting over 33,000 hospitals nationwide. We welcome you to Medical Dialogues, sir.
Thank you, Nandita, and thank you for having me, and it's a pleasure to be here.
So, sir, if you can tell us a little bit more about your book, actually what is the background and what actually led you to publish this book?
Actually, the idea of writing this book actually came to my mind many years ago. I am an orthopedic surgeon, and as some of you know, I spent my entire life in Bangalore Baptist Hospital, and I felt the need to know a little more about law when I was heading the institution. That was somewhere around 2006-2007. And also because of a couple of bad experiences earlier on. In fact, I remember the first time I got a legal notice, I was unable to sleep for 2 days because I was expecting the police to come and arrest me. That is what ignorance actually creates. Having said that, I think the situation among the medical community, and when I say medical community, I'm talking about the doctors, the nurses, administrators, and all those who are related, who are practicing, who are dealing with patients. The curricula is so designed that nothing much else apart from medicine is really taught. So there's focus on medicine. So that's why we doctors are lousy communicators. We are not good finance people. We know very little about the law. And one of our objectives at HPI is to try and empower doctors. And to that end, we have actually been successful in some areas. We have been able to introduce communication as a subject in the medical curriculum. It looks incredible that it wasn't, but we were able to introduce it in 2019, and that was a result of a book we had written on health communication. So coming back to health law, we medical professionals know very little about the law, and I think it's important that we are aware about some aspects. The curriculum at the moment is absolutely packed, so there is absolutely no way that this can be included as a module either in the undergraduate or postgraduate medical education. So the alternatives are to empower yourselves. Now, I did a course with the National Law School of India University, the premier school in our country, It's been on the top of the list for the last as long as I can remember. So we've been working with them, and they have a program called PGDMLE. I did that program. I found it very useful. It helped me a lot when I was leading Baptist Hospital and subsequently. So the first thing we did was that we said that this course should be publicized. More people should be aware of it. Fortunately for us at that time, around that time, the think tank of health in India was developed. This was an idea which was encouraged by Dr. Professor Kasturi Rangan, the chairman of the NEP, and we have the vice chancellor of the bank, NLSU, as the chairperson, and the other eminent people on that think tank are Dr. Devi Shetty, Dr. Chris Gopal Krishnan, Professor Bhabatosh Biswas. I'm also privileged to be a part of it. So this was one of the areas that think tank felt we should work on. So as a result, we were able to get the Law School of India to have 2 additional centers outside Bangalore. So more people could attend the course, etc. And the first center outside Bangalore was at CMC Vellore, and then there was one at Meenakshi Mission in Madurai. Unfortunately, COVID came in between and we had to stop that. So parallelly, we thought that yes, all of us may not be able to attend these courses because it involves money, it involves traveling out, it involves other things. So what would be a viable alternative which would also help? And that's how this idea of the book came about. We thought about it for almost, I think the concept was about 3 to 4 years ago. It took us about 2 years to come up with something, and because of COVID, it was slightly delayed. And my colleagues who did this were Dr. Nandimat, who was the registrar of NLSU at that time, and Ms. Arpita, an assistant professor at law school. Now, the unique thing about this book is that each chapter is done by a doctor, a practicing doctor, and a lawyer. So we're looking at it from both aspects, from the legal aspect through the eyes of a doctor, so it would be easy to understand. So that's a little bit about the concept and how we took things forward.
So how do you think this book will be useful to the young budding practitioners as they step into the next stage in their careers?
People who are studying now, like this communication is now, I think it's being taught to 2 lakh students every year, and when they pass out, they will be empowered. So yes, I agree with you that if a module can be introduced, if we can convince the medical council to introduce, that will be ideal. I think it's absolutely essential, and that's why we went about doing this. This is actually a very large, very complicated project because we had to get doctors and lawyers together, and it wasn't easy. So I think there's no doubt about it. But then having worked with the Medical Council, the National Medical Council, it looks unlikely that it would be introduced into the curriculum because there's absolutely no time for it. Yes, I would strongly recommend that a module of this be introduced sometime, either in the undergraduate or postgraduate. But I think till that, there has to be other mechanisms of empowerment of medical professionals, and this is one way.
So lastly, I will just want to talk about, or rather ask you, what are the key takeaway points that you would want to enumerate on?
The book is actually divided into 3 sections. The first section is the macro policy context, and there we look at health as a human right. We look at ethics very importantly. I think that's something we shouldn't forget. Then we look at universal health coverage. How can the law and we work together to make healthcare accessible, quality healthcare accessible and affordable? And then we also focus on an area which is often neglected, that is health laws in relation to the vulnerable population and to the elderly population. These are 2 classes of population which I think we need to focus on a little more. They're actually neglected at the moment. And we've added in the first section, since it was done during COVID, we also thought that was important, and we've introduced a chapter on that in the first section. Now in the second section, we look at the law of the doctor-patient relationship. And here we look at how the profession is regulated. Very importantly, as you said, we look at the law of medical negligence. And then the law of consent and medical treatment, we look at confidentiality. And another, an emerging topic, regulating violence against medical professionals. And how we can handle that. And in the second section, we also look at end-of-life care, which the government has actually been working on for some time. And section 3 is on focused regulation of healthcare delivery. And here, consequent to the pandemic, I must tell you an interesting story. AHPI has been trying to legalize telemedicine for the last 4 or 5 years, and we were facing all sort of obstacles. So I think COVID has a silver lining, because soon as COVID came in, the government accepted our recommendation and made telemedicine legal. So we have, that's very, I think, very relevant to the present time, and we have a chapter on that, the Indian telemedicine practice. And I must say that each of these chapters have been written by authorities in the area. Then we also have a chapter on law of organ transplantation. And here the National Law School and the HPI have been part of the Karnataka government's efforts to regulate, to sort of ensure that organ transplantation is made relatively easier and is available at all hospitals. Mental health is another issue. Unfortunately, post-COVID, we are told that there is at least a 30 to 40% increase in mental health issues. So we have tried to address that in one chapter. There is a small section on regulating pharmaceuticals. Then I think something relevant now, the law of surrogacy. And for hospitals, I think the biomedical waste management and the law. And very importantly, medical research and the law. I think research is so important, and we need to have some basic idea of what are the laws relating to that. So in a nutshell, this is how we have actually written the book to empower medical professionals and try to give some basic information. And also, if more information is needed, there are also links to other information. Basically, this is what we've done.
I really thank you so much, sir, for taking out your valuable time, and I really hope that this book will reach out to as many, so that this important topic on health law and ethics reaches the healthcare professionals globally.
Thank you very much.
That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.